The conference is an educational event for members. We have attracted speakers from many countries, from as far back as Italy, many from United Arab Emirates, from Egypt, from Amman. So the whole aim is education. And the aim of educating surgeons is to improve practice. And when you improve practice, you get better outcome. So the ultimate aim is better care for our patients.
So what are the challenges in spine specialties?
Well, the first challenges is that there are many patients. You know that Nigeria is a very populous country. There are very few that are trained to operate on the spine. We have just about 700 orthopedic surgeons total and less than 90 neurosurgeons. Like I said in my address, even if all of us are operating on the spine, we will still be inadequate. But the actual fact is that just about 40% of us are actually operating on the spine. So the first thing is the volume, large number of patients, few people adequately trained. That's why we're taking the issue of training very seriously. And then the facilities, even for those that are trained, because it's very expensive acquiring some of the modern facilities that are used in spine care. And then the system in Nigeria where patients pay out of pocket. Those are insured an almost negligible percentage of the population. And then you have all these factors make it difficult sometimes to provide prompt care, especially in government facilities. Well, the way forward, like this type of conferences, educational activities, because the practitioners have to be up to date in what is available, and then the general issues that have to do with health, with regards to improving facilities in specialist areas, in terms of finding innovative ways of taking care of sick people, especially those who cannot afford paying from out of pocket. Getting some structures in place that will make it possible to assist those who need this intervention. Those are the things that we need to work on. So when those improve, the ultimate attention to these people will get better, especially in things that involve surgery. There are things you can consider as naturally occurring, like somebody has a cancer, like an infection. And then there are things that are due to activities, that is to say, your own activities can contribute to those problems. And then there are things that happen following injury. In terms of spine problem, the most preventable and most pathetic when it happens is when an otherwise healthy person who is not challenged by any natural sickness exposes himself to factors that causes him to be injured to the extent of getting paralyzed. One of such things is falling from heights. Next to that is a big issue of road traffic accidents involving both cars, motorcycles, tricycles. These are preventable things usually. And again, when you talk about those injured with spine problem, a large number of them are from these two causes. Of course, we do have some cases of assault, like stabs and gunshots, also causing. So you see, all these are very preventable. The other things that you need to do is lifetime modification, for people to be a bit enlightened as to posture, as to balance, as to how to lift weights, and with that they can protect their spine. The last is awareness that when you have a problem, it is good to go and get it investigated on time.
The spine specialty is a reasonably new specialty with a huge potential. The spine covers from the base of the skull through the neck, upper back, lower back, and the bottom. The challenges we're having right now is facilities for training, for local training. We have a dearth of it. Instrumentation and support equipment, we are also low in that regard. But the good side is that we have a huge volume of specialists who are interested. For spine surgery, we have an amalgamation of orthopedic surgeons and neurosurgeons. And we have quite a large number of people who are really interested in spine. And spine has a huge potential. Everybody sometime in their lifetime will have back pain, neck pain, and it may require some surgical intervention. So for now, we have a huge potential, and we are hoping that we get adequate support both from the industry and from government, from facilities, so that we can expand on this robust subspecialty, which is a common reason why Nigerians have to travel abroad for surgery. We want them to increase funding for spine surgical facilities within our tertiary institutions so that they can do much more. Once we have the manpower, once the infrastructural capacity is put in place, definitely we'll have robust participation and improved participation and much better outcomes.
Okay, my name is Dr. Sydney Bianisi. I'm the Supervising Director for Trauma in the Federal Ministry of Health, but I'm here representing the Permanent Secretary, Federal Ministry of Health, Alhaji Abdulaziz Abdullahi. Spinal disease is a very common disease that affects virtually all of us. In fact, they say for every person older than 20 years, by the time you live through your life, the chances are you have up to 80% chances that you would have had some problem with your back pain. That's the common language most people know. However, having an association like this, Nigerian Spine Society, is well encouraged, because this is an association of professionals, highly specialized medical persons that have come together to be able to promote the knowledge and treatment of spine diseases. And for us in the government and Federal Ministry of Health, we welcome the idea, and it's a collective effort, because we'll be willing to join hands with the Nigerian Spine Society to ensure that the education is promoted, that the practice of spine surgery is encouraged and promoted. A good number of Nigerians that travel overseas for medical tourism actually do so for spine-related diseases. So if we're able to do it locally in the country, that will reduce the number of persons traveling out. Apart from the huge capital flights that leave the economy, you also have a number of inconveniences of persons that have to travel with complications that are associated with it. So if we have centers in the country where these conditions can be treated locally, so it's highly encouraged, and it will help a lot of us to build the workforce, the human resource workforce that we need to drive the economy.
Most of the patients that have spine problems still go to the government hospitals, and I think in order to be able to help them adequately and make sure they can get good outcomes, there needs to be some investment in like X-ray, which is a fluoroscopic machine, so that people can actually have X-ray to be able to see the spine and decide what needs to be done. A lot of the teaching hospitals, federal teaching or state teaching hospitals, don't even have proper X-ray machines to be able to take care of these patients. I think there needs to be some investment in training and education. There used to be international training for some of our consultants back in the days. For spine surgery and spine care, I think that's something that's essential.